Welcome to Safe and Sound, sponsored by White Mountain Fire and Life Safety. Today on the show we have Janelle Lynn, the Public Health Nursing Supervisor for Navajo County Public Health Services District. Welcome, Janelle.
Hi.
I'm glad you came.
Thank you.
So, what do you do for public health?
I'm the nursing supervisor. We have a staff of public health nurses and I supervise them. We offer a variety of programs to the public. We have family planning for under and uninsured women. We offer vaccines for children. We have adult vaccine programs. We do HIV and STD testing, and we investigate all the reportable infectious diseases for our county.
Wow, you're a little busy.
We are.
How many nursing staff do you have?
We have a variety of full-time, part-time, and contract nurses, but
Wow.
altogether we have 6.
Wow. And I know that you guys have a lot of volunteer nursing that help with emergency preparedness as
Right.
well, which is a pretty significant number. I don't remember the number.
I'm not sure that's through our bioterrorism program,
but there's a lot of nursing involved in public health.
Yes.
Which makes sense.
yes.
Now, I had you on the show because I wanted to talk about vaccines.
Okay.
And right now there's a lot of controversy. Do I give my kids the shot? Do I not give my kids the shot? People with the internet, people do their own research and they become basically experts
Right.
on wherever they want to research.
Right.
So my kid is vaccinated fully. Are yours as well?
Yes, I have 5 kids and they are fully vaccinated and they're the healthiest kids I know.
Then the same with mine. I've never had an issue or problem. And I noticed the controversy out there is there's a lot of people who are completely against vaccines.
Right.
And I don't want to just single them out, but I am going to a little bit, just to help them educate themselves. I used to be against vaccines. I was not going to vaccinate my daughter. I refused to. I hung out with a lot of people who were like-minded. Mm-hmm. And they would say, oh yeah, this guy did this whole program on how kids, it causes autism. Then kids die from vaccines all the time. And so when I had my daughter, in fact, she wasn't vaccinated the first year I had her. And I started thinking and seeing, like the whooping cough came out and it was pretty big when
Right.
in 2008. And I kind of got freaked out and I was like, you know what, I need to research this disease or the whooping cough and see what it can cause. And it was pretty a significant issue.
Right.
And I'm like, I don't want to affect my child's breathing. And then so I started investigating, okay, let me investigate the good stuff about the shots. You know, what does it protect us against? What does it do? Why should I get my child vaccinated? Mm-hmm. And that's when I changed my tune, because I was actually investigating, how you said off camera, science-based
Right.
information. Now, why did you get your kids vaccinated?
My grandma had polio when she was 5 years old, and she was a polio survivor, and she was one of the lucky ones who only had to use crutches her whole life. And I just saw the effects that it had on her health. I saw the effects it had on her mobility and her lifestyle, and she was very pro-vaccines. She wished she had lived in a time when they would have had a polio vaccine to prevent her from contracting the illness. So we grew up in a very pro-vaccine family. If our parents had chosen not to vaccinate us, Grandma probably would have driven us down and made sure that we got the shot. So to me, there was that component. And then when I went into nursing school and I started studying the diseases and the disease process and seeing, you know, the other vaccine preventable disease and how they affect people's lives. And one of the things that lengthened the lifespan for individuals was the development of vaccines and sanitation, you know, sewage and disposal of proper sewage disposal. When those two things came out, the lifespan more than doubled in less than 5 years. So that to me says alone that it's a life-saving thing. And I think it's important to research the diseases themselves, not just the vaccines. People don't see these diseases anymore because they've all mostly been eradicated through vaccines. And people, in my opinion, who choose not to vaccinate are safe because of those who do choose to vaccinate. And they're relying on herd immunity. Well, there's becoming a large enough population who doesn't vaccinate anymore because they're relying on that safety of the herd immunity from those around them that do vaccinate, that we're starting to see these diseases resurface. They had almost completely eradicated polio. They're seeing it start to resurface now because not enough people are vaccinating. So if 95% of the people in your community are not vaccinating, that's what's considered needed for you to have adequate herd immunity, is a 95% coverage rate. And in some of our communities locally, we're down to around 87%. So we cannot rely on that herd immunity, and we're going to start to see these diseases resurface. So don't just study the vaccine, study the disease, see what it can do. They kill people. They don't just make you sick, they kill people, especially infants or immune compromised individuals, the elderly, you know, your really at-risk populations. Also, make sure that you're studying evidence, science-based, you know, sites. It has been totally discredited that the MMR vaccine causes autism.
I found that out.
It's actually been proven that the doctor who supposedly, you know, verified that study was paid by a group of individuals to falsify his information. And he was in Europe and he had his license revoked and came to the US and has had it revoked here as well. So make sure that you're getting your information from evidence-based material and not just somebody's random opinion.
That was one of the things that me and my husband, you know, researched a little bit on and saw that, and the effect that he had. I mean, what a jerk. Because what he's doing is he's not allowing parents to make the right choice in protecting their children. They're making a choice based on a lie.
Right.
I mean, he only, I guess, got his information from 12 kids.
And he falsified a lot of that information.
Which is not enough to do a study anyway. And so I believe in the MMR, and especially with the recent measles outbreak. I'm sure that you guys have seen an increase in people getting their MMR.
We do. We have some people who have always exempted their kids from immunizations coming in requesting the MMR vaccine, and that's great. We love to see that. We'd like to encourage them to consider the other vaccines as well, because diphtheria is just as detrimental, if not more so, than MMR. In all of these vaccines prevent against some terrible disease, and who knows what's going to surface next week or next month or next year. So why not be protected in advance?
No, that makes a lot of sense. I know that I have an infant now, and I know that she can't get her MMR for a year.
Right.
And I'm limiting the kids that come around. And I hate to do that, because you know what? To each their own.
Right.
It's your child. It's your responsibility. I'm not here to tell you what to do and what you can't do for your child. I hope that we can educate you to make, you know, a good choice. That's not just for you, but for other children. But I ask the parents, is your child vaccinated? Yes. Good. Okay, they can come over. Just because I can't protect her from anybody who's unvaccinated. And not saying that kids that are unvaccinated are going to come in and get her sick. No. But if, for instance, the MMR, I was doing some reading when it came out, because I get a little obsessed when stuff comes out, so I'm like reading everything, you know, because I get scared. Right. And they won't know. They can not know their symptoms from like almost a week.
Right.
And so you have a kid running around, you know, infecting other people, like what happened in Disneyland, and the ones that weren't vaccinated ended up carrying this to other places. I mean, that's how this is going to get around. And so, yeah, it's I would like to think it's not likely, but it could.
Right.
There's a slight chance it could happen. If there's a slight chance that something could hurt my kid, I'm keeping my kid away from it. And so if I would have had somebody over that had it and was in the, I guess, contagious stage and not seeing any symptoms yet, that means my baby has it now, and now my baby's in the hospital and might not make it because she is 5 months old.
Right.
And so we've been called, oh, you're putting your kid in a bubble. Yeah, I am. Yeah. And I have to, because there's people who choose not to vaccinate their children, so they're not protected against these diseases like her.
Right.
You had talked earlier about There's people who can't get shots because they have a poor immunity, like I guess kids with cancer maybe?
Actually, with cancer, you can't get vaccines while you're undergoing your treatment. But kids who undergo cancer treatment, then they're that much more susceptible because their immune system is kaput because of all their chemotherapy and their treatments. And then it wipes out what immunity they may have had from any vaccines before their therapy, so they have to be completely revaccinated once they're done with their treatments.
See, and as a parent, I'm lucky I don't have that, you know, in my family. I don't have a child that has cancer. I've been very lucky because that would devastate me. And I know that there's a lot of families out there that are going through a very hard time. I want to protect their kids if they can't protect their kids because they've already got dealt the poor hand. You know, I will do whatever I can to try to make it easier for that child to come out and play and have fun. And you know, when they're not able to, I mean, it's very hard to see families going through that, and I don't want to make it any harder on them. I know that Alice, when she reached the age, because I do have a 6-year-old that is fully vaccinated, she will be fully vaccinated. There's some things that I personally, from reading, that I wait on, like the chickenpox vaccine. I wait until she's 5. For me, and this is only because I'm like, well, I've had the chickenpox. If she gets chickenpox before then, awesome. But my grandfather is 87. He's never had the chickenpox. If he gets the chickenpox, it will kill him. And so I figure if she doesn't get it by 5, then I'm going to vaccinate her and not worry about it. But I'm comfortable because I've had it with her getting that one. Unless something happens and it turns out to be this like intense, you know, what do? They mutate into something different. But
well, one of the things that a lot of parents don't consider is for chickenpox, for example, most of us have had chickenpox. It wasn't that big of a deal, you know, it's pretty routine, it's part of growing up. But what can happen now is that we have drug-resistant staph viruses floating around that we didn't used to have when you and I were little. And now what they're seeing is a lot of kids get chickenpox and they get to scratching, and pretty soon they've got MRSA, or they have got, one of these drug-resistant viruses and flesh-eating bacteria. We've really, in our state, seen kids that have suffered from things like that. And we had one mom in the Valley who the state has worked with to do a whole campaign that this happened to her child, and she refused the vaccine at the one-year visit, and her child contracted chickenpox in that year, and she did get a flesh-eating bacteria and ended up having some real complications and real disfiguring surgeries to treat that problem. And she's a real vaccine champion now.
Okay, well, you changed my mind. That was easy.
So I think it's great when parents educate themselves, but I think you need to educate yourself more than just to the vaccine. Educate yourself to all the other possibilities that you can be exposing your child to. And one of the things that's frustrating to me as a nurse and as a parent is that I understand that as parents we need to make the choices for our kids. I don't want to be told how to raise my kids. I want to do what I feel is best for them as a parent. But one of the things that's frustrating to me is that if I choose to vaccinate, I am protecting my children and I'm protecting everyone else's children through herd immunity. Those that choose not to vaccinate are not only getting to make choices for their children, they're getting to make choices for our children as well, because they're exposing those of us who have children like you under the age of 1 that cannot receive some vaccine yet, or immune compromised kids, or things like that. And to me, that's not really fair.
No, you're right. Well, and then it's bringing back these diseases that were supposedly eradicated. I mean, eventually we're going to have smallpox back. I mean, it's devastating to see what some people are going through. I hope that this last outbreak hasn't killed any kids.
Not that I know of, but
yet.
You
Okay.
can.
Good. Well, has anything come up to the mountain yet, or are we still
We have had no confirmed cases of measles in our county.
Good.
So.
Good. Well, that's good.
Right.
Thank goodness.
They have in some of the other counties in Arizona, but we did not have any confirmed cases.
Okay. Well, wonderful. Now, with the vaccines, they can come down to the public health department and get vaccines. Is it expensive? How does that work?
If you have insurance, we can bill your insurance for your vaccines. If you are uninsured or underinsured means you have insurance but it won't cover that particular vaccine, then we have a grant through the Vaccine for Children's program through the CDC, and we can give you your shots for free, absolutely, completely free of charge. And we stock all vaccines. We We also have a travel clinic, so if you're traveling abroad and you need some of your more exotic vaccines, Japanese encephalitis, yellow fever, we offer those as well.
Oh, wow.
So you can come in by appointment or on the second and fourth Tuesday of each month in our Sholo office from 1:30 to 3:30. We have a walk-in clinic, and on the second and fourth Tuesday of each month in Snowflake at the Taylor at the Taylor Fire Department, they have a walk-in clinic as well from 10 to 11:30.
That's awesome. You know, I also, now that I work with public health, I saw that you guys did the flu vaccine. You did a drive-through clinic?
We do. We partner with our emergency preparedness program, and we set up with different fire departments and do drive-through clinics. And we do that to practice for if we ever had to respond to an event, so a disease outbreak or a bioterrorist threat, and we needed to be able to dispense mass vaccinations or medications to the general public quickly. So one way that we prepare for that and practice that is to partner with our local fire departments, and then we do these flu shot clinics, see how many people we could vaccinate in X amount of time. And it keeps us in practice. It gets the public somewhat used to getting medications or vaccines in this manner. And then it's also a resource if we had to respond to an emergency, a way that we could rapidly dispense medication or issue vaccines to the public.
And how do you promote this? I mean, how do people hear about it?
We do 1 or 2 of those a year, and we usually, it depends on the agency we partner with, because in an event, they would be the ones
To promote that out to the public?
Yeah, and so it depends on what they want to utilize, but we use social media, we use the radio, we use the newspapers, just various.
And they just drive up, hand you their insurance card, and get a shot?
And when we do it that way, it's usually free.
Oh, really?
Yeah.
Wow.
Because in an event, it would be free.
It would be free. My husband and I got I've never had a flu shot until this year. And they said that this year it didn't, it was only 70% against,
This year the flu vaccine wasn't as effective. There was a drift in one of the strains that was included in the virus, and they kind of have to guess at what's going to circulate that year, and in one of the strains they were off a little bit. So it was only 23% effective against the A strain that was circulating this year, but it was 72%, I believe, effective against the B strain. So it was highly effective against the B strain that circulated this year. So therefore we've had very few reported cases of B flu. But the A strain, it wasn't as effective. But still, 23% is better than nothing.
Absolutely. Well, I didn't get anything. My husband didn't get sick. And before we were so like I said, I had some issues with shots before I started educating myself. And one of the things was, there's mercury in there. Well, there's more mercury in the fish you eat.
Right.
And so when my husband and I researched out, because we both were in the same, about the flu shot, not about the other shots. And then we went and got it, and Rob's like, I'm getting this again next year. I'm not even going to deal with it. So we, we've tried it. My daughter got it because we did. We have the infant in my house. She's born in October, which is getting into flu season. I'm like, you got to be kidding me.
So you do it to protect her.
Yeah.
Even though it's 23% efficacy rate, it's still, if you contract the flu, it's going to be a milder case.
Which would be a lot better.
Which is better.
Yeah, and same with the chickenpox. I mean, I heard, and I don't know if it's true, but if you do vaccinate yourself and you end up getting it, it's not
a milder
nothing.
case.
It's like a couple pox and you're done.
Right.
Which actually is also a nice thing to do too, because then you're not getting this, putting this kid through this hardship. I remember with chickenpox, I remember showing, because my mom had 4 kids at the time, and all 4 of us got it. If one of us sick, we're all sick, and we were just, we staggered it, and my mom was sick for 3 months. But I would show them how you pull your shirt up and you lay on the carpet and you just scoot. And I just remember that, and I'm like, it was horrible, and then you get the scars from it. But yeah, I think with vaccines though, I'm grateful that they're here. I know that other countries would love to have the vaccine, the capability of getting vaccinated. And it's like the same thing that your parents tell you, other people in other countries are starving, you need to eat your dinner. Other people in other countries
are dying from these diseases.
Yeah, and don't have the luxury of doing this. I mean, throughout the world, I think there's been from 2000, I'm trying to remember the statistics that Rob got, from 2000 to 2000 and to now, there was I think 112 people supposedly killed from MMR. That's they got the MMR, and then after, whether it was a year after, whatever, they ended up dying, 112. And then with the measles, mumps, and rubella, there was 176,000 people that were killed
Right.
between that time.
Definitely of measles.
Of
and
measles.
the 112, was it really related to the vaccine?
Exactly. And so that's when I started going, okay,
Yeah.
I really need to rethink about protecting my children. And I know that the controversy is big on Facebook. I know that
It
people
is.
are getting very upset, and it's very hard for me not to say anything because I don't want to offend people, and I don't
Right.
want to lose friends over this. But I just want people to educate themselves to do the best thing, not just for themselves, but
Right.
for the community. You know, we're a team.
Mm-hmm.
We're a community. It's not you and I. You know, we're in this together. Let's do everything we can to, again, eradicate this disease, you know, and further.
Right.
So what are the hours of the health department in case somebody wants to come in and get a vaccine?
In our Charlotte office, we are open Monday through Friday from 7 to 5:30. If you don't want to wait in line, call and make an appointment. If you don't mind waiting in line, come to one of our walk-in clinics that I mentioned earlier, and we'll squeeze you in.
Are your guys' shots any different than the shots that they get at other places? Are they all the same? They come from this?
Vaccines are the same.
Okay.
One of the things that might be different at the health department is that all of our vaccines are administered by registered nurses. We don't use medical assistants. So, you know, we've been well trained in school, and we go to an annual vaccine conference that's 3 or 4 days long. We receive training on at least a quarterly basis. We're very up to date with you know, the latest vaccines, the latest recommendations, the contraindications. And there once in a while is a contraindication for a vaccine if you have a specific allergy or health condition or things like that. But we're very cautious in screening for that. And if you come with us, all of your vaccines will be administered by a registered nurse.
Oh wow! And if you have insurance, it's covered. You
Right.
can bill the insurance. And earlier we were talking. There's not a lot of public health places that can build insurance.
No, we're one of the few public health departments in the nation that's able to bill insurance for public health services. So we're really proud of that.
Navajo County doesn't realize what a gem that they have.
We have a great health department. If you're not familiar with us, you should come down and get acquainted with us.
Well, Janelle, thank you so much for coming on here.
You're welcome.
This was so important. This is such great information. You definitely know what you're talking about. And,
Thank you.
And I'm going to actually bring my daughter in to
Good.
get her vaccines there.
Good.
And we'll go from there. So again, thank you so much for coming on, and thank you so much for watching. And we will see you next time on Safe and Sound.